Now that school is back in session, medical specialists are preparing for a resurgence of mental health concerns among students.
It's a growing issue. According to the Maine chapter of the National Alliance on Mental Illness, 14,000 kids between the ages of 12 and 17 have depression in the state. It's not just young Mainers struggling.
Data from the organization also shows more than 200,000 adults have a mental health condition. That's nearly the total population of York County. And while each person has individual needs, there is a common issue.
Finding the right care that's affordable and finding a trusted community. News Center Maine's Sam Rogers spoke with providers and specialists about ways parents and individuals can help their loved ones get the support they may need.
On the left side of the field, we'll have all of our community partners.
George Magellis and his team at the Maine chapter of the American Foundation for Suicide Prevention are preparing for Saturday's annual Out of the Darkness Walk in Bangor.
Many people find suicide something that's one of the most difficult things to talk about, to start a conversation or to keep a conversation going.
These walks encourage those conversations and build a sense of community.
I always think about that person who maybe had a recent loss and they don't really know how this is going to sit with them for the rest of their life, and just to see that they're not alone. I think that's one of the most meaningful parts of the event.
Magellis lost people close to him to suicide. After spending 25 years as the director of mental health services at an out-of-state community college, he's back in Maine helping others, especially younger Mainers.
The pressures are so much greater than they were when we were young.
I've been seeing kids and families struggle with how to take care of their own mental health and how to navigate the mental health system.
That's Dr. Christine Crawford, a child psychiatrist and the associate medical director for the National Alliance on Mental Illness.
Yeah, it could be really confusing to figure out where do you start when it comes to getting your kid the help and support that they need.
That's why she wrote this book, a guide to helping parents and caregivers navigate their children's mental health.
So I recommend that folks talk to their pediatrician about any mental health concerns, because a lot of pediatricians are actually well trained in how to provide some basic care.
It's really the wave of adolescent medicine where they want the providers to know how to do a lot of these skills.
Dr. Brock Libby is an adolescent medicine physician for Maine Health. Having difficult conversations with younger patients about their mental health is now a big part of his job.
I think more of them want to talk about how they're doing emotionally than the previous generation before them. And that's really awesome, and that's really great that they want to talk about that. We just need to know how to support them in the best way possible.
When it comes to youth mental health, the thing Libby worries the most for everyone is suicide. Even with patients across Maine having issues finding the right care, there are a lot of positive results in this doctor's office, and there are ways parents can help. Libby recommends that you listen to your kids and don't feel that you need to solve anything, and make sure they have someone they trust, even if it isn't you.
Not necessarily an adult, a trusted human that they can talk to, and they can be real, and they can be open, and they can be vulnerable what they're feeling.
It's also important, Libby says, for kids to track their progress.
Because all too often we put our belief and value system upon the patient, but that's not better for the patient.
Using the tool of curiosity is a way Dr. Crawford says parents can start mental health conversations at home. Like, I noticed you're not interested in hanging out with friends anymore. What's behind that?
You then have an idea as to what steps you could take forward with your kid to get the help and support that they need.
Sometimes that support is a trusted person you can talk to, or a specialist you can meet with, or in the case of the Out of the Darkness walks, finding a community that's there for you.
Many times we go through our life thinking that what we're experiencing no one else has gone through. So just that opportunity to bring people together to say you're not alone.
Sam Rogers with that report. The Out of the Darkness walk begins along the Bangor waterfront at 10 o'clock Saturday morning.
Also, Dr. Brock Libby says if your child or someone else you know feels comfortable enough to share their mental health concerns with you, you should be honored by that trust.
We have a lot more from our conversations with these experts posted on our website and our News Center Maine app.